With a decrease in age, almost half of the male population in the world faces issues with their prostate gland. Among all of the possible problems, the most common one is the enlargement of your prostate, affecting the overall quality of life. Therefore, a wise step is to go for timely medical intervention before this common issue turns into life-threatening prostate cancer. This video discusses the top 10 signs of a troublesome prostate gland so you can seek appropriate medical help before it gets too late. Frequent urination. Are you experiencing a frequent urge to urinate, especially at night? This is because you have discomfort in your bladder, often because of an enlarged prostate. This symptom occurs because the enlarged prostate gland can compress the urethra, the tube that carries urine from the bladder out of the body, causing bladder irritation and making it difficult for the bladder to hold urine comfortably. As a result, individuals may experience the urge to urinate frequently, including during the night. Studies were done on the prostate gland, and urinary problems show that this can be due to blockage in the tubes and can restrict the flow of urine. What's worse, it can disrupt normal sleep patterns and the daily activities of an affected person. Urinary urgency. People with an enlarged prostate often feel a sudden compelling desire to pass urine or suffer from urinary urgency. This simply means increasing your visits to the washroom more than usual, or you can say after every hour. This urgency is a clear warning sign that you have an abnormal prostate and need to shrink it with possible lifestyle changes. However, you might question the reason behind this frequent urination. Generally, it occurs due to the compression of the urethra by the enlarged gland. This compression obstructs the flow of urine from the bladder, leading to a buildup of pressure within the bladder itself. As a result, the bladder becomes hypersensitive to even small amounts of urine, triggering a sudden and compelling urge to urinate. This sensation of urgency can be particularly pronounced when the bladder is not entirely emptied during urination due to the obstruction caused by the enlarged prostate. Thus, you feel the urge to urinate again and again. Weak urine stream. Do you often take more time to urinate to spend hours in the toilet? This is due to a weak urine stream, which is a leading sign of an enlarged prostate. The most common cause of this is the blockage of the urethra, or having a weak bladder. This is because prostate enlargement negatively impacts the urinary system. As the prostate gland enlarges, it can constrict or partially block the urethra. This obstruction impedes the flow of urine, causing it to exit the body with less force or in a weaker stream. Additionally, the muscles of the bladder may need to work harder to push urine past the obstruction, further contributing to the weakened stream. Consequently, individuals with an enlarged prostate often experience difficulties initiating and maintaining a steady urine flow. Bladder damage. A disturbed or enlarged prostate can put pressure on your bladder, affecting its overall functionality in the body. When the prostate gland enlarges, it can constrict the urethra. This constriction can lead to various urinary problems, such as difficulty initiating urination, weak urine flow, and incomplete bladder emptying. Over time, these urinary issues can place strain on the bladder muscles as they work harder to overcome the obstruction caused by the enlarged prostate. This increased workload can lead to bladder hypertrophy, thickening of the bladder wall, and decreased bladder capacity. In severe cases, it can even cause damage to the kidneys due to back pressure on the urinary system. Hematuria. If you have had the lucky charm to observe your urine, you might have seen a change in colors than usual. It might appear red, brown, or tea-colored due to the presence of red blood cells. This blood in the urine is a sign of an enlarged prostate. When the prostate gland enlarges, it can put pressure on the bladder and urethra, leading to irritation of the bladder lining. This irritation can result in small blood vessels in the bladder wall breaking, causing blood to appear in the urine. In some cases, an enlarged prostate can obstruct the flow of urine out of the bladder, leading to the formation of bladder stones. These stones can cause damage to the bladder wall, leading to bleeding and hematuria. Enlarged prostates are also prone to developing infections or inflammation, such as prostatitis. These conditions can lead to irritation and inflammation of the prostate gland, which may result in blood mixing with the urine. Bladder stone. Another visible sign of an enlarged prostate is the harmful bladder stones. These stone particles can directly block the flow of urine, making it difficult for you to urinate under normal conditions. Urine that remains stagnant in the bladder provides an environment that favors the formation of bladder stones. Due to the obstruction caused by the enlarged prostate, the bladder may not completely empty during urination. Residual urine left in the bladder can become concentrated, leading to the precipitation of minerals and the formation of stones. So, next time you see a stone, quickly consult your doctor to get help with your enlarged prostate. Dribbling after urination. As men age, they face issues with their urinary flow due to problems in their prostate gland. One of the most common signs that you have prostate enlargement is dribbling after urination. It can be due to blockage of the urethra, urinary tract infections, or potential bladder stones. All of these factors can affect the flow of urine. Thus, small amounts of urine may remain in the urethra after urination, causing dribbling or leakage when the individual stands up or moves. Additionally, the muscles of the bladder and urethra may weaken over time, further contributing to dribbling after urination in some cases. Let us know in the comments below if you have also faced immediate dribbling after urination. Urinary tract infections. If your bladder is not completely void, it can be due to some urinary tract infections caused by an enlarged prostate. This is because the presence of an enlarged prostate can alter the pH balance of the urine, making it more conducive to bacterial growth and UTI development. What's worse? Residual urine left in the bladder can serve as a breeding ground for bacteria, leading to several urinary tract infections. Painful ejaculation. Enlarged prostates are prone to inflammation and infection, which can lead to pain or discomfort during ejaculation. The muscles surrounding the prostate can undergo spasms due to the pressure exerted by the enlarged gland. These spasms can result in pain or discomfort during ejaculation. Moreover, it can put pressure on nearby nerves responsible for ejaculation. This compression can lead to altered sensation and pain. Kidney damage. Being the vital filtration body organs, the kidneys are at greater risk due to an enlarged prostate. When the prostate gland enlarges, it obstructs the urinary tract, leading to severe kidney issues. UTIs can cause inflammation and infection in the urinary tract. And if bacteria reach the kidneys, they can lead to kidney infections and potentially permanent damage. In severe cases of urinary obstruction due to an enlarged prostate, a condition known as urinary retention can occur. Urinary retention is the inability to empty the bladder completely. When urine is retained in the bladder, it can increase pressure on the kidneys, leading to kidney damage over time. Therefore, while an enlarged prostate itself may not directly cause kidney damage, the associated urinary obstruction and complications, such as urinary retention and UTIs, can contribute to kidney dysfunction and damage if not properly managed. This wraps up the 10 common symptoms of an enlarged prostate. From increased urine frequency to urinary urgency and kidney damage, every sign can significantly impact your quality of life if left untreated. Therefore, if you have any of these symptoms, immediately consult your doctor before you deteriorate your body's health. Share in the comments if you notice any of the above-mentioned signs, and subscribe to this channel for more valuable health updates.